Well, hi everybody. So excited that we're welcoming you back to GW Center for Integrative Medicine podcast about health healing and disease prevention, treatment, and integrative medicine. I'm your co-host, Dr. Misha Kogan, Associate Professor of Medicine at George Washington University and Medical Director of the Center for Integrative Medicine. So I have a very special time today with longtime mentor and now more of a colleague, Dr. Wayne Jonas. We'll have a little bio for Dr. Jonas. Dr. Jonas is a physician, board certified, practicing family medicine, and an expert in integrative health and whole person care delivery, and widely published scientific investigator. Additionally, Dr. Jonas is a retired lieutenant colonel in medical corps at the United States Army, and from 2001 to 2016, he was a president and chief executive officer of Samueli Institute, a nonprofit medical research organization supporting the scientific investigation of healing processes in the areas of stress, pain, and resiliency. Dr. Jonas wrote the best-selling book, How Healing Works. And even though that's not the topic of today, I think that's a wonderful book, and we'll make sure that we have a link to that book if anybody's interested in purchasing it. And this book laid out a revolutionary new way to approach injury, illness, and wellness. He is also co-author of a second book, which we are talking about today, and I have it right here, and we're going to talk all about this. And he co-authored this book with Dr. McManamon, and the book is The Healing and Cancer, A Guide to Whole Person Cancer Care. And this book is meant to be used actively by teams caring for people with cancer and by caregivers and patients to enhance healing, health, and well-being, particularly of patients with cancer. Dr. Jonas was the director of Office of Alternative Medicine at National Institute of Health, which is now National Center for Integrative Health and Medicine, from 1995 to 1999. So that's just when it started. And prior to that, he served as a director of the Medical Research Fellowship at the Walter Reed Institute of Research. He's a fellow of American Academy of Family Physician, and currently he's a president of Healing Works Foundation. We'll make sure that we get all those links for people interested. It's a nonprofit dedicated to an integration of healing and curing in routine healthcare delivery. Dr. Jonas, so much welcoming you to the podcast. Thank you so much for joining us.
Great to see you, Mikhail, and call me Wayne. That's fine.
Great. Wayne, it's so good to have you here. So, I've been following your work forever. It feels like even before medical, like even in the first 2 or 3 years of medical school, you were like our main voice of academic integrative health. You've done a lot of different work. I think if we're to kind of discuss different things, we're probably never going to have enough time in the day to cover what you've done. But, I chose that for us to talk about your book, the recent book. Well, first of all, it's recently came out. And second, I'm curious why you decided, you're concentrated on a cancer because you've done work so broadly, right? You looked at pretty much any whole health, any integrative medicine topic, but you did choose clinically to kind of go into cancer. So what prompted this book?
Yeah. Well, thank you, Mikhail. I'm grateful to have to be on your podcast. I looked at a couple of them, and they're fabulous. You really get some great topics and great people, and very, very interesting area. So I'll tell you a little bit. I've worked as you indicated a bit in the bio to really help people understand where does health come from, and how does health happen. And unfortunately, we've mostly been brainwashed to think, well, you go to the doctor and the doctor tells you how to do that. But the data actually shows otherwise. If you look at the actual determinants of health, what drives health and creates health, only about 20% of it comes from medical care at the most. Mm-hmm. Even with optimal coverage and insurance and really great doctors. And most of healthcare actually comes from something that medical care does not focus on, and that is the process of healing, or what I sometimes call salutogenesis, the generation of health. But you wouldn't be around if your body wasn't creating health on a moment-by-moment basis. Our inherent healing capacity is the big driver. And we now know, as I wrote in my first book, what the core factors are that facilitate that process. Mm-hmm. Uh, it's behavior and lifestyle. It is social and emotional components. It's mental health aspects. It's the environment in which you live. And it is the meaning and purpose of your life. If you get up and you're doing something that brings you joy, that brings you purpose, that really drives you, that and social environment are the biggest factors for a long, healthy life. And then
Mhm.
after that, things we hear about are, good sleep and a proper diet and activity and exercise and that type of thing in those areas. Well, those are the drivers. Those are what keep us healthy. And in fact, just because we get a disease and we go in and see the doctor and we get a label, like heart disease or chronic pain or cancer or something like that, and the doctor comes in and says, well, treat this and treat that, the underlying drivers are still there.
Exactly.
uh, and in fact, if you can ratchet up those wellness factors, those determinants, health, it'll do much better even with the treatment, even with the medical treatment. And so integrating the medical treatment along with what produces health is sort of the core thing our healthcare system needs to pivot to
Mhm.
if we're going to, lower costs, improve population health, address disparities, manage, improve and actually create population health. All of those factors are going in the wrong direction, actually, right now. Costs are going up, satisfaction's going down, disparities are getting wider, and health of the population is not improving. Our mortality, our life expectancy in this country, in the US, has dropped significantly. And that was even before COVID. And during COVID, it dropped even more, and especially for people of color, even dropped at a much faster rate. So we need to shift our model and really focus on these underlying inherent factors of healing. That's what the first book is about.
Right.
Now, I pivoted to cancer for a number of reasons. First of all, it is a very common and a growing disease. Okay. It's estimated that there'll be close to 26 million people living with cancer in the next few years, partly because we're getting older and it's tends to be a disease of older individuals. And partly because our treatments are helping people survive longer. Okay. So now people are actually living with cancer, not dying of cancer, even though when you hear the word, that's the first thing you think, right? The fear. But actually, chronic disease, it's becoming more and more of a chronic disease that's managed.
Mhm.
And if you incorporate those same inherent healing processes, those personal determinants of health, then you will do better, you'll live longer, and you'll feel better. The second reason is that the cancer treatment system has, because of its intense focus on killing the cancer,
Mhm.
has largely neglected those wellness factors that I just talked about that drive health and well-being. There's just not enough time in the day, and so the payment system will pay for the treatments, but it won't necessarily pay to help you learn how to improve your diet. Keep active, get involved in social support, manage your sleep, and those kinds of things. Those tend to be left on the side. And so there's a huge gap between the optimal type of care for cancer patients and the kind of care we're getting. And the treatments for cancer are not benign. Okay.
Say
You
the
can,
least.
yeah, I mean, if you have diabetes, you take, a little bit of insulin and it doesn't wreck your life. But if you have cancer and you take, some of the chemotherapy, surgeries, other types of things, boy, the side effects are pretty severe. So we need ways of keeping people feeling better, managing those side effects, completing treatment. And that's another reason why the integration occurs. So
So you divided the book in a couple different sections. So there's a section, sort of the why and what of the whole person of cancer care. Then there's a section, the second section, on whole person healing throughout the cancer journey, and the third is more like a tools and resources for the delivery.
yeah.
So I mean, I think this is in within the sort of your typical way you think about whole health, right? But just walk us a little bit through those sections, like why is the book divided this way, and like what are the readers going to get in each part?
Well, our hope with this book is that your average mainstream, either patient and or oncology team will
Mhm.
pick this up and say, ah, this is the direction we need to go. Actually, most oncology teams know this, most patients know this. There are resources available, such as those at your center there at GW, that are available, but they're not accessed. Okay. And so the real goal of this book is try to make it clear and easy as to how this happens. So we started with the why at the beginning of the book, so people realize there is a huge amount of science behind this. Okay. I'm an evidence-based medicine practitioner. I want to use good science for making decisions about what I do and don't do. And when it comes to whole person cancer care, there is a lot of evidence. Not only evidence that people do better if they incorporate person-centered and whole person care into their daily activities, but also so we now know the biology of cancer points in this direction. You know, it used to be that we thought, well, gee, cancer is this rogue cell and it just sort of starts acting crazy and growing, and we just need to get rid of it. But we now know through decades of detailed investments in research that that's not the way it occurs. It actually, cancer and the environment in which it lives, the immune system, the inflammatory environment, the microbiome, okay, what's in your gut, all influence this process of growth, non-growth, and whether it escapes those factors or not. That's all called the tumor microenvironment. And there's a detailed description of that science. There's even something called the hallmarks of cancer, which show that environment and how that interacts. So you can't think of cancer biology anymore as simply a tumor. You have to think about it within the environment. And the macro environment, the behaviors, okay, influence that tumor microenvironment and therefore influence the biology of cancer. So that's number one. The science is there, and doing good evidence-based cancer care requires we pay attention to those environments. The second part of the book is an attempt to give people an opportunity to enter in and begin to do whole person care wherever they are in their journey, whether they are simply worried about it because maybe there's a family history of cancer. Sorry, I'm outside, so got a plane flying over. And they want to do things to help prevent it or reduce the risk of that. So we talk a little bit about that. But most people find out about it when they actually get the diagnosis, right? What I call the boom, okay, the word, and that generates a huge amount of fear. People are afraid that they're going to die immediately, but they don't know that there's a lot of things that they can do to actually stay well and improve their treatment. So we wanted to show through the journey. Now, it doesn't always work. People do die of cancer in those areas, but these factors can also help people, especially in the area of palliative care, to help them feel better. Okay, even if the cancer isn't cured in those areas. So, we needed to bring that in. So we wrote that section of the book to show wherever you are in the journey, there is a way to do whole person cancer care. And here's some particular things that apply in those settings. And then finally, the ultimate goal of the book is to get, the mainstream to actually begin to do this. And it doesn't have to be daunting. It's actually doable. And so we show many examples of how cancer care centers from around the country and even around the world are doing this, both in a small and a big way. They're shifting their cancer care designs. And we give tools for those that want to do this, that they can bring it into their teams, they can bring it into their practice programs, and they can begin to implement it and make it routine and regular. So that's the last part of the book. And then our website gives even more tools than the book to help folks do this.
And we'll make sure that all those links are in the description. So if somebody is going deep into this, then they can get easy access to that. So, it struck me you're kind of an expert in this whole health, but a lot of people don't actually understand what that means. I think you would think it's self-explanatory, but I think our healthcare system has been so reductionistic that a lot of people they may have an intuitive sense of what whole health means, but it's not what actually gets done, and that's not how they get the medical care, right? They get very reductionistic model. So let's talk just for a minute, like, what does the term means, and particularly how do people can create that whole health paradigm in their own lives?
Yeah. Yeah. So by whole health, we basically mean three things. Okay. Number one, really asking the question and answering the question, if you can, which changes, the answers change as you go through the journey about what's the most important thing in your life and how does healthcare help you get there? That's the what matters question. Okay, that's sort of the spiritual existential question, if you will. Um, and so that question, number one, needs to be asked for patients who are undergoing treatment. Okay, is this treatment going to get me to the goals that I want? And that may change throughout the journey, and we illustrate that in the middle section of the book. I'll give you an example. Had a patient the other day who's been through multiple treatments for different cancers. And she came in to start a whole series of treatments for sort of the new one that she had. And the team asked her, well, what can I do to make your care better? What's important to you? The what matters question. And she was very clear. She said, Fridays, I spend time with my grandson. Okay. That's our sacred time together. Okay. I have a grandson and I love to spend time with him. He loves to spend time with me. Fridays are out. Okay. Do not schedule anything for me on Fridays anytime during the day. That means tests, that means treatments, that means follow up sessions, that means phone calls. Okay, great. So that's what mattered to her on that particular part of her journey. So the team then could, addressing those issues, say, fine, we're going to design your treatment plan so it isn't just willy-nilly come back in tomorrow without consideration of you as a person, but we're going to pay attention to that. We're going to write it into the treatment plan, and we're going to make sure that you're feeling good enough on Fridays that you can have that sacred time on what's important. So that's number one. And it'll be different for different people at different times. Okay. But you still ask that question and you find out what does the person need and want? What's important? What's their driver? And align the plan around that. The second thing is to not ignore anything about what makes up a human being. Okay. Don't pretend the mental health is not all that important and they can just deal with it themselves. Don't pretend that the social and the economic situation is not that important for access to care. It is important. Don't pretend that behavior and lifestyle are not important because you don't want to have them feel guilty if they can't do it all. So in those areas, address those questions. And in the first book, I gave a model of 4 layers of a human being that are a simplification of Maslow's hierarchy that's been around for 70 years and are still hold as to what humans need. And this is what is a human being. And make sure you address each of those areas and identify the core aspects of how to put the whole person into the picture, see the whole person. It's very easy to do. It's the physical external environment. It's their behavior and their lifestyle components. It's the social and emotional environment they're in. They may not want to talk about it, but it's still there. Ask them about it. Open up an opportunity for them to talk about it. And then the mental and the spiritual, which requires sort of a deep partnership, a trust, a listening, opening up a space for what really matters to them, for them to emerge, giving them permission, empowering them to be able to speak about that. Those 4 layers, the physical, behavioral, social, emotional, and the spiritual and mental, are what make up a whole person. Whole person care is don't neglect any of those. Okay. Ask about them, pay attention, see the person as a whole person. And then the third and final component of whole person care is the term I think I used a little bit earlier in this talk, salutogenesis. All right, that's a technical term, but basically it means health creation. The saluto means health, genesis is creation. So you and I, we went to medical school and we studied pathogenesis, right? The generation of disease. We forgot about the generation of health. And so whole person care means paying attention to that generation of health, support those processes. They're going on all the time and try to help enhance and accelerate those. That's whole person care.
Yeah, unfortunately, that last point you brought up, I think the healthcare in US is really not a healthcare. It's you're saying always this, we have a disease care model. We don't really have a healthcare model. I mean, we don't help people with salutogenesis. We have no I mean, look, the nutritionist Medicare only covers for diabetes and end-stage renal disease. Like, it's kind of too late at that point. That you really should be preventing all these conditions with nutrition, and yet the system is not in place. And so you've been advocating for this kind of a model to be shifted for a long time. Let's deviate just for a second away from the book, and we'll come back to it. But you formed this new nonprofit, and you're leading it right now. Can you tell us just a little bit about, because it's doing this really critical transformational work to try to really change the entire healthcare system in this country. So
Yeah.
what sort of is going on there with this work?
Yes, this is a new foundation. It's called Healing Works Foundation. It's only about a year old. We've started it a little over a year ago. It is generously funded by the Samueli Foundation out in California, but it's its independent own operation. Its goal really is about transforming our health system to a whole person care system. That's fundamentally its goal. And so it focuses on thought leadership. We do a lot of work, for example, with the National Academy of Medicine and Sciences. We do a lot of work with policy experts in these areas. We do a lot of work with national organizations. For example, for this cancer book, we've got a partnership with the American Cancer Society to bring these tools into the American Cancer Society. At the end of the week, I'm going to the American Society of Clinical Oncology, the biggest cancer care group. We do a lot of work in primary care. In fact, our first thing we focused on in general medicine is primary care. And we're focused there on changing not only the practice and the educational components, but also the payment models. So the salutogenic components of it that we just talked about, the health generating components, are now covered and they become part of standard routine care. And that's coming along really well. I would say stay tuned. We'll do another podcast here.
We absolutely will.
After the politics gets over, to see where the federal and the state governments are going to really enhance whole person care in primary care. And that's coming along very well. We would like to see that happen in cancer also. So Healing Works Foundation is trying to drive this conceptual change to whole person care, the thought leadership, the payment models, and then the educational components that go along with this. We partnered, for example, with Tufts University to create some continuing medical education components to show people how to do this both in primary care and one that will come out, within the next couple of weeks in cancer care in those areas. So those are free educational programs that are available to providers and clinicians, nurses, and physicians in this area.
I'm curious, you picked the cancer as this kind of a clinical center for the whole health for now, for yourself, for advocacy and for a lot of things. Why cancer? It's such a difficult disease. The problem is you mentioned 26 million people have it, but I think there's something very philosophically challenging for our psyche, right? The moment a person hears the word cancer, there's kind of a doomsday scenario. I would think that like taking a simpler topics that have not a lot of good management tools like chronic pain, for example, would be a lot easier, but you choose this one. Why?
Well,
the most difficult topic?
Well, to be clear, Healing Works Foundation, when it first started a year ago, did focus on primary care and chronic pain, or major areas. So we did go after those first because those are the areas that cover the broadest number of illnesses within our society. Okay.
Right.
But as we were doing that, we heard more and more from folks that cancer had a huge gap in this area. And so we did a couple surveys. We partnered with some survey organizations that did national surveys, asking the patients what their needs were in cancer care, and also asking oncologists and cancer centers what they had available and where they were going. And it became very clear that there was a huge gap in this area. The patients wanted it. The oncologists thought it was important, but they didn't know how to actually do it. And so there's this huge gap in between because they didn't know how to do it. They didn't talk about it. And the patients were off on their own trying this and that, and nothing got integrated in between. And so the gap was huge. and the need was huge. And so it was sort of a logical way to go. I've also had cancer in my family. My wife got breast cancer when she was 34. Okay, young woman. Okay, we had young kids, et cetera, et cetera, and she's dealt with other cancers over the years in those areas also. And so I've seen it personally in my life, interacting with the system and seeing what we got and what we didn't get. And so the goal here, after doing so well and seeing the momentum within primary care and chronic pain in the whole person care grow, we thought, well, let's take this one on. We know it's challenging, and that's the precise reason we want to do it, because the need is so great.
So I'm sure that a lot of our listeners are sort of wondering, there's so many things you can do for cancer in terms of whole health treatments and also holistic treatments. What's sort of on your mind as being kind of the most significant development in the last couple of years? Like what clinically do you think uh, a lot of patients would benefit in this kind of more integrative arena?
So there's a couple chapters in the book where we really go into what does the science say the benefit and the risks are going to come from. What's the low hanging fruit in those areas? And interestingly, they're the same things that you go after when you're treating other diseases. Okay, this is the sort of the dirty little secret behind whole person care, isn't it? Is that, okay, you have this disease, you have that disease, you have another disease, and in medicine we treat them all differently.
That's
But
right.
in health and care, there's a fundamental set of drivers that affect them all. Okay, these core wellness drivers that I described to you before. And so what we did in those chapters is we said, let's collect the science around wellness and specifically look at what we know about what works and what doesn't work in cancer care. Okay. For example, exercise is something that is completely not thought of. You're fatigued, you're tired, you're under getting treatment. And so, well, I can't exercise because I'm fatigued. Well, extensive research has shown that exercise will mitigate the symptoms of treatment, and they will improve both the quality and the length of life of people with cancer. It's a great way to alter that microenvironment. We now know, with the breakthroughs in immuno-oncology, okay, the relationship between the immune system and cancer, that there are drugs that are altering the immune system, and some of them can be very effective. They're not, miracle for everybody, but for certain people, they can be very effective. But we also know they're effective because they interact with the immune system itself, and the immune system interacts with the microbiome. That's the bacteria in your gut, which is influenced by your diet, right? Okay, in those areas. So before, we would see that diet contributed both to the development in cancer and its mitigation, but we didn't really know how it worked and didn't know how to actually implement it. So nutrition is very important. Most people get told when they come in, just eat whatever you want.
That's
Well, yeah, I mean, if you're on immunotherapy, that may not be the best thing to do,
Yeah,
especially.
like we have this all the time, in a clinical realm. We would patients say, "Oh, my oncologist say I can eat all the sugar I want," and we're like, "Oh, no," and it's so hard to break through this.
It is.
So I'm glad you highlighted that because I
Well,
think it's really
and then non lifestyle things that aren't formally lifestyle can have a huge impact. For example, people with high social support, they've got a good network of support to help them get through the journey. They have a 25% lower chance of dying compared with those with social support. That's about as good as you can get for most drugs, right? Better than many drugs.
that's
Okay.
right.
25% lower. So social support. So I always ask my patients and I explore with them, what is their social support and can we beef that up? Can we enhance that in those areas? So
Mhm. So, we're kind of sitting in this moment where, like, yeah, it's pretty bleak. Current oncologists telling people eat whatever they want and all that. But, I think you wrote this book in hopes that it's not just for patients and caregivers, that actual care teams will read it. Oncologists will read it, and the directors of cancer centers will read it. So what are you hoping for? What do you think in terms of a long-term kind of the future of the oncology with integration of whole person care look like?
So we were encouraged by a couple things. One, we saw it going on out in mainstream medicine. There were bits and pieces of it going on.
Mhm.
And then before we wrote this book for 2 years, we pulled together some leaders in oncology from around the world, mostly in the US, but also some in Canada, Israel, other places. Uh, and we spent 2 years exploring what does whole person care look like if you needed tools to do that in your system. And we had a lot of them developed already for primary care. Those have been developed. Can we adapt those? And then how do you begin to get this enhanced within your system? And these were major centers, all over the country, major cancer centers, mainstream cancer centers. So we spent 2 years working with this group, translating the information into those areas. And then we brought in experts. And in the last chapter of the book, you'll see this, okay, in practice change, okay? This is sometimes called quality improvement. It's sometimes called practice improvement. But this is something all health centers do or should be doing, is getting better, right? And there's a whole system for doing that. It's very well written out. There's organizations that will assist in that area. And so the hard work of actually implementing it simply means saying, take this topic, bring it into your practice change processes, and begin to embed it into your system. And now we see this happening. So we have a set of examples that are on our website, and we describe some of them in the book. We're presenting an abstract at ASCO, the large cancer meeting, that actually shows examples of this going on. So it's actually happening. And so I was encouraged by that. Okay. And then the language from national leaders, such as those who are doing the moonshot, for example. The moonshot for cancer care is a federal effort to change cancer as we know it. That's their words, okay? Reduce mortality and improve the experience. And these types of things align perfectly with that. This is a way to change cancer care as we know it. And so I've had conversations with the folks at the Moonshot a couple times and say, bring these things into your efforts and begin to get them funded and delivered, because organizations are now trying to do that. So our hope is that, in 5 years, okay, after this effort is over, we now have the majority, if you will, of cancer centers who, number one, know what it is.
Mhm.
Number two, know how to do at least some of it. They've made it high priority and have implemented it in their practice improvement and their quality improvement programs around the country, including learning how to pay for it. Okay.
That's right. That's the big one. I think that's the one that's currently probably deters a lot of smaller centers from trying to do this because they don't have a payment model for this.
Payment is a huge issue, not just for the centers, but for patients.
For patients, yeah.
So, and this is even independent of whole person care. Just getting standard tumor treatment, okay, cancer treatment, is creates financial toxicity for many people. Healthcare, I think, is the fourth reason for bankruptcy in the country. Okay, is because you can't afford your basic healthcare, and cancer treatments can be very expensive.
And in
And
a very short time. It's not like,
yeah,
Alzheimer's treatment is expensive, but it may take many years for that price to accumulate. But here you're talking hundreds of thousands of dollars in months
yeah,
in a very brief period of time. Yeah.
that is correct. And if we shifted our payment system so that it was a value-based system, so it paid for all aspects of care that you need, rather than sort of nitpicking the fee for service. Oh, I'll pay for that one, I won't pay for this one. That's what breaks people's banks, right? But if they would pay for the bundle of care and then optimize that care, they would save costs. And we actually have evidence that you can lower costs with a whole person approach, not just increased costs. But you have to be willing to invest in
Right.
creating a system that will actually create that type of care.
Yeah. You keep saying we, so I think we really have to give Alyssa, Dr. McManamon, a credit because she co-wrote the book with you, and she's the oncology expert here. So do you want to just tell our listeners a couple of words about who she is, why you guys partnered, and
Yeah,
what's
so Dr. McManamon, Alyssa McManamon, was my co-author in this book and a wonderful co-author. She's a great writer, a great thinker. I would have to say that, and I don't know if she'll agree with this or not, she brought the heart into the book. Okay, she really brought the heart into the book. She was in the Department of Defense for a number of years. She now works part-time in the VA as a general oncologist, and she has taught Rachel Naomi Remen's The Heart of Medicine course to medical students for decades. And so she really brought and taught me in the writing of this book the key question of empathy, of listening, of finding out what matters, and
Mhm.
spending the time to develop a relationship with the patient so that you can design your treatment plan with them and co-design it with them, and this will provide the optimal care. And her voice is through that. We started off sort of dividing the chapters up, and she would write one, I would write one. We ended up co-writing all the chapters in those areas because I wanted to make sure the heart was in the center of every single part of this book.
Yeah, so I want to, if it's okay with you, I want to, there was a couple of, well, I'm a palliative care doc, right? So this is my passion. So I was reading this, I think it's a chapter 10 on and the end of life, and I just want to kind of read a little bit of Alyssa describing a story of one of her patients. I think it kind of, for me, it's summarizes the power of the book in a way, but also the power of kind of being able to not just meet the patients wherever they are, but really take every step of the way as a lesson. I think there's a lot of, in oncology specifically, there is a lot of attempt at putting a separation between the patient and the clinical team and say, look, I can't emotionally get involved because it's hard. But actually, that is the goal, I think. I think that is the way for us to all stay human and really practice whole health, is to really open up and go there with the patients. And I think this is just so highlights this beautifully. So I'm just going to take a couple of minutes to read this. And this is a page 195. Years after a woman received adjunct chemotherapy from one of my colleagues, she was back, now a mother and facing metastatic cancer. She fought hard to remain on chemo, but had many of the complications that limit later lines of therapy. Still, she wanted treatment any way she could get it so she could live to see her firstborn wedding. We pushed the envelope on blood count parameters, proceeded more aggressively for a time. The cancer progressed and she refused hospice despite transitioning off chemo. Her partner, a trained medic, provided expert care and brought her in for periodic clinic visits. They looked more depleted by the week. After many months of having worked as a sole oncologist, I welcomed a new partner and soon after headed to a much needed family vacation. One day, standing in a noisy playground in Orlando, I received a call from my new colleague. My patient was in the hospital and not doing well. They were moving to comfort care. 2 days later, following my morning clinic, I made my way to her bedside and for the first time met her brother and elderly parents. Her spouse, the consummate caregiver, quickly ushered me to his seat at her head. She was alive but unresponsive. I held her closest hand as he took the one opposite. We spoke of her life, and then she died hands in ours. After her family members hugged her torso and cried over her face and kissed her scalp, where there were no more words. Only then did I fall back to the rites of listening to her chest and looking into her eyes. Then closing them, carrying out the ritual not done since my internal medicine residency many years before. As an oncologist, I find myself so far removed from death that this happening seemed novel and ancient. And I see that she was in charge all along, and that I honored her wishes more than not. Months later, her medic spouse came to see me. He wanted to give me something and proceeded to press a heavy embossed challenge coin into my head, emblazoned with his prior office symbol and rank, a token of great value in military culture. I read it aloud from the words held in my hand about the promise of care by medics in his unit. I was deeply moved. He told me that a few months before she died, he lost his favorite pair of sunglasses. They looked everywhere, turning the house upside down, but couldn't find them. For his birthday, she gave him a new pair, but they weren't the same. A few days prior, he got into his truck and saw sitting right below the speedometer his lost pair of sunglasses. Standing with me in the exam room, he began to weep. We helped together while we sobbed. As we separated, he concluded she was telling him that it's okay and that he can finally stop worrying about her.
Like I said, she wrote that part. That was her experience and her patience.
I can't read this without crying. Really. It's that powerful.
Well, thank you for reading that part. I think, it does get at the heart of not only cancer care, but of medicine in general. I think it's ironic that she says, as an oncologist, she felt distant from death, right?
Right.
One of the curses and one of the blessings of cancer is that most of us go about ignoring the fact that from the time we're born, we're all on a journey to death, right? And it could happen anytime, and it does happen to everybody. Cancer says, can't ignore that anymore, even if you're going to have a long life with it, right? It tells you, it now puts it in your face, and so you have to face it. And if there is a lesson, it is a hard lesson, I agree. But if there is a lesson in that, it is that journey is about learning how to love every single moment, no matter what the circumstances are and what the challenges are and the suffering are that you have to go through, is being there with others, listening to them, loving them, being present with them. There is this type of discipline, as you know, palliative care. You're a palliative care physician. And if you look at the guidelines, the research guidelines for palliative care in cancer, they say that everybody should have a palliative care visit and plan from within 8 weeks of their diagnosis. Okay, within 8 weeks, not at the end of life, not when they end up going into hospice or don't go into hospice, but from the very beginning, because the word cancer itself and the journey puts hard questions in front of you, right at the front. And it is the palliative care that is designed to help us deal with those difficult conversations and get to an experience, the best experience that we can have during that time. Our foundation is funding something called the Serious Illness Conversation. That is developed by and is being tested now by Adriana Labs up in Boston. And it is teaching clinicians how to have these kinds of conversations, okay? Not right on the deathbed, okay, but from day one of the diagnosis, and especially when it becomes serious, as it often does in cancer. So thank you for reading that passage there. That is, in fact, the heart of the book.
Right. So, well, we can't finish on this. We have to finish on something a bit more positive. So what has been your most rewarding experience in practicing and advocating for whole person cancer care?
Yeah. So I think the biggest thing is the flip side of what we were talking. There is hope, even if there's no cure, and healing can occur even when there's no cure. But we also are having an explosion of new types of treatments and new types of approaches that have come out because of this biology that I mentioned earlier, because we now know the details of the environment and the cancer process. So immuno-oncology is one of those. We mentioned that, but now there's targeted therapies where you can identify, particular receptors on cancer cells, and you can go after those. And so we're able to really define specific, individualized, personalized plans that can help people do better, live longer. And the death rate in cancer has dropped significantly, I think 33% since 1991, as I write in the book. And so this all shows not only is there hope for living with cancer, there is also hope for treating cancer. And so never give up hope. Because one of those is going to be in your journey, if you have that, and work and ask your team, hand this book to the team and say, I want this type of care. This is the kind of cancer from the time you get the diagnosis, and then work with them to actually make it happen in your own journey, in your own life. So there is hope always. And that's why I wrote something called the Hope Note, a series of questions that you can have that conversation with patients to make it whole person.
As you always say, from soap is the way that current medical records are written, subjective, objective assessment and plan, to hope, to really kind of much more salutogenic, much more health rather than disease management paradigm shift, which I
stands
think
for healing oriented. That's right. Healing oriented practices and environments. It's a set of questions designed specifically to get at those salutogenic factors. Yeah. Mm-hmm.
So our time is running out. I think I do want to kind of leave on a more positive note for our listeners. So what advice would you give to someone how to maintain hope and resiliency in the face of often, cancer journeys are hard?
Yeah, absolutely. I think the most important thing is that you look for it. Okay. And even if you can't see it at the time, if you're in the dark night of the soul, all it means is that the vision of what can bring you forward in a loving and even a better treatment environment is there somewhere. And so go deep into those conversations, go deep into yourself, look for the evidence, talk about the evidence, yes, but don't ignore your own intuition, okay? Pay attention to your own intuition. Some people do it with prayer, some people do it with meditation and silence, but find out what matters to you deeply in those areas. And then out of that can emerge often a light that takes you towards the next part of the journey. And so hope is always there. The question is, spend the time and the inner discipline to help it get revealed to you. So I'd encourage everybody to do that and buy the book and give it to their oncology team and say, I want this type of care.
Exactly. Well, Wayne, it was such an honor and pleasure having you here. Thank you so much. Just for our listeners, this is Wayne Jonas, Dr. Wayne Jonas, the author of new book, The Healing and Cancer, a guide to whole person care. So do get it on Amazon or whatever your preferred way of purchasing the books. It's an Audible, right? Or not yet?
It is. Oh yeah. Oh no, it's not on Audible yet, but we're still working on that. But it's available through any apps outlets. There's a website for it, healingandcancerbook.org or .com. And our website at the Healing Works Foundation has many more resources, even beyond this book, to help you on this journey.
Great. And we'll make sure that everything's in description, that people can get in touch with your team if they're interested in something more specific. And thank you so much for coming.
Well, thank you for having me, and thank you for all you do also to make this type of thing happen in your practice and with your patients.